Hello, Assalamu alaikum. This is Dr. REZWAN from the Department of Anatomy at Abdul Somes Medical College. Welcome to the online session of lecture and the demonstration classes. Today, from the Department of Anatomy, I will discuss about the joint. By this time, you know that there are different types of joint in our body. So let's start with the definition of the joint. How can we define the joint? Previously, the definition was quite simple. They say that it is the union between bones. But nowadays, we know that the definition is quite detailed and quite larger than this traditional definition. So, please write down the definition of the joint. It may be defined as the structural arrangement joining the neighboring osseous elements by some binding materials where movement is possible or not. I am saying it again. It may be defined as a structural arrangement joining neighboring osseous elements by some binding materials where movement is possible or not. It's not finished yet. You need to write something more. And this arrangement is present within a bone, in between bones, in between cartilages, or in between bone and cartilage. The thing is that in this definition, we have collected some knowledges that actually what is actually happening inside a joint. The first thing we notice that we use the term osseous elements. Now, what are the osseous elements? Usually, bones and cartilage are considered to be the osseous elements. Because we know that inside a joint, there is not only bones but also cartilages. So in this case, when there is a joint, there will be articulation between the bones through the cartilages. Sometimes it has been seen that this articulation is happening in between bone and cartilage. So in that case, the traditional definition that it is the union between two bones is not working. So we have to modify the definition. At the same time, we have seen that inside a growing long bone, there is a plate of hyaline cartilage. By this time you already know, this is called the epiphyseal cartilages. And this epiphyseal cartilage is present at the growing end. Not only the growing end, but also the other end. But in case of the growing end, it is persisting for the longer period of time. When this cartilage is present in a long bone, actually this is a epiphyseal cartilage. And there is a joint over there. And that joint is called the epiphyseal joint. So in this situation, inside a bone there is a cartilage and it represents a joint. That means joint is present within a bone. That signifies that the definition of the bone also includes that it can be present within a bone. There is no need for the articulation of two separate bones. So that is the point. Number 2. If you notice that in our thoracic cage, there are some ribs. There are 12 pairs of ribs on the either side. That means 12 ribs on each side. But at the same time, you have noticed that the ribs are not articulating with the sternum directly. First, they need to continuous with the cartilage, and that cartilage, which is called the costal cartilage, it is going to the sternum to articulate over there. So obviously, each rib is touching the sternum through their cartilages. So a rib, when it is continuous as a cartilage, that is called the costal cartilage, there is a joint over there in between the rib and its cartilage. So over here, there is no two bones kind of thing. Over here, bone and cartilage. So as we have put that it can happen in between bone and cartilage, it is correct. Now the next thing, I have said that it can be present in between cartilages. Yes, there are some cartilages who are present inside our larynx. They are called the laryngeal cartilages. In case of laryngeal cartilages, those cartilages are articulating with each other and they are also forming joint. So it's not necessarily that the joints should be present in between bones. In case of laryngeal joints, the cartilages are articulating with each other. That signifies our another topic. Now, the last one was it can happen in between bones. Yes. Sometimes when two bones are articulating with each other, it is bypassing the articulation through the cartilages. Usually we know that each bone is covered at their end by the articular cartilage. Usually they are the hyaline cartilage. But over here, they are articulating with each other by some binding materials called fibrous tissue. Maybe you know that the suture joints which are present inside our skull, they are articulating with each other through some fibrous tissue. Those suture joints are also type of joints. Over there is no cartilage. So over there, bone is connecting with each other. Two bones are connecting with each other. So there are four things we already know. Inside a bone, there could be joint. In between two bones, there is joint. In between two cartilages, there is joint. In between bone and cartilage, there is joint. So the definition of the joint is quite larger than you think. Now, today I will discuss about the synovial joint, and you need to know what is the classification of the synovial joint. Let me tell you, synovial joint can be defined in the different ways. It can be classified according to the surfaces of the articulating surfaces. That is actually the classification that is called the morphological classification. Sometimes they can be classified according to their axis of the movement, which is called the functional classification. And lastly, it can be classified according to the number of the articulating bone. Let's start with the number of the articulating bone. You know that when we think about a joint, we actually think that two bones are articulating with each other. But sometimes more than two bones may be present over there. In that case, the name of the joint is quite different. Remember, when we are classifying the joint according to their number of participating bone, it could be simple. In case of simple synovial joint, there will be two bones who are articulating with each other. Suppose the glenoid labrum of your shoulder, that is called the scapula, is connecting with the head of the humerus. That is a shoulder joint. Two bones are participating over there. It's a simple joint. Sometimes there are more than two bones who are present inside a joint. For example, radiocarpal joint. Radiocarpal joint, you know there are some carpal bones, especially this scaphoid and the lunate. These two bones are articulating with the lower end of the radius to form the wrist joint. Over here, three bones are participating with each other. So in this case, the joint is called the compound joint. It is called the compound joint. So, simple joint, two bones are articulating with each other. In case of compound joint, more than two, it could be three, are articulating among each other. And lastly, another classification is called the complex joint. So what is complex joint? Very simple. The joint cavity should be divided into two compartments with some intra-articular structure, specifically intra-articular cartilages. Intra-articular cartilages are usually fibrous cartilage. For example, in case knee joint, we know that there are two fibrocartilage plates present inside the knee joint who are actually acting as a cushion over there. They are called the meniscus. these two C-shaped meniscus are dividing this joint into two compartments, superior compartment and the inferior compartments. So, when the joint cavity is divided into two compartments by some interarticular structure, in that case, this joint is called the complex joint. So, according to the number of the participating bones and the structures that is present inside the joint, we can classify the synovial joint three types: simple, compound, and complex. Now, what about the axis of movement? Sometimes you know that the movement can be held by the flexion and extension, it can be held by the adduction and the abduction, and it can be held by the medial rotation and the lateral rotation. For example, when a joint is moving like this, you can see my hand, I am flexing my fingers, and this one is my metacarpopharyngeal joint, my knuckle. When we are movement, our movement is like this, flexion and extension. That means it is having a axis called the transverse axis. Can you see that? Transverse axis. This pen represents my axis. It is called the transverse axis because this axis is present transversely. So, single axis, two movements. Transverse axis, two movements, that is called flexion and extension. At the same time, if you see my palm of my hand, can you see that I am abducting my fingers and at the same time I am opposing them? This is called the adduction, this is abduction. Right now the movement is happening through this axis. Can you see that? This axis is called the anterior posterior axis. So in this case, the adduction and the abduction is happening through the anterior posterior axis. So obviously, again I am saying single axis, two movements. Transverse axis, that includes flexion and extension, and anterior posterior axis, that includes adduction and abduction. Now, if any movement is happening like this, that is the rotatory movement, it could be medial rotation of your shoulder joint, it could be lateral rotation. The axis is actually vertical. Anything, suppose this pen is rotating like this, so don't you think that the axis should be vertical? So the vertical axis having medial rotation and the lateral rotation, and when all the movements are combined together, the movement could be circumduction. So according to the movements, it could be vertical axis, it could be transverse axis, it could be anterior posterior axis, and it could be multi-axial joints. Now the last one, the classification, is the morphological classification of the synovial joint. For your kind information, whenever we are talking about the morphological classification, we need to know that what is the actual morphology of the articulating surfaces. When the articulated surface are very much plain, very plain surface, two plane surface, suppose I can use my paperweight over here, I can see that there is a surface which is very much plain. At the same time I can use a duster over here. This surface is also plain. So when the two joints are actually present in between two plane surfaces, that joint is called the plane joint, plane type of synovial joint, because the surfaces are plane. When the joint is present in between two reciprocally convexo-concavo-convex surface, that joint is actually saddle type of synovial joint. Most probably you have seen that the body of the horse is like convexo-concavo-convex kind. So there is a saddle over there to ride the horse. So the surface, when it is not plane, it is initially convex, then concave, and then convex. In this situation, this articular surface is quite unusual, and when the joint is happening at that type of convex or concavo convex kind of surface, and that is called the saddle joint. Okay, so this is one thing. Another one is condylate type of joint. You know that when there are condyles, there will be some joint like femoral condyles are there. Then we have the condylate type of synovial joint. It could be hinge type of synovial joint. You know the hinge of the door, that is unidirectional movement, it always happens. So there is hinge type of synovial joint, and also there will be ellipsoid type of synovial joint. So in case of morphological classification, I will show those pictures in our actual classes, but right now you have to know about the name of this synovial joints, that is hinge, that could be condylar, that could be ellipsoid, that could be saddle, and even that could be pivot. So these are the morphological classification of the joint. Now let me tell you something. I am finishing it. Today I will discuss another topic that is called the structure of the synovial joint. Maybe you know that synovial joint is having a cavity that is called the synovial cavity, and that synovial cavity is very unique because synovial cavity contains synovial fluid, and even you know that synovial fluid is present inside the joint to facilitate the movements, for the smoothness of the movement, and for this purpose the synovial fluid is always producing inside the joint. So from where the synovial fluid is coming from, where they are coming, actually they are coming from the synovial membrane that is present inside the joint. So what happens when two bones are articulating with each other? They are actually covered by a cartilage that is called the articular cartilage, and that cartilage is nothing but the hyaline cartilage. At the same time, these two articular cartilages along with the end of the bones are held together by a fibrous capsule that is called the fibrous capsule of the joint, or the synovial capsule. This capsule is very important because they are very tightly adherent the ends of the bone to form the synovial joint. Now inside this capsule there will be a cavity that is called the synovial cavity, and that synovial cavity is containing synovial fluid. But from where they are coming? They are coming from the synovial membrane. Yes, that synovial membrane is lining the inner aspect of the synovial joint, and that synovial membrane is producing synovial fluid constantly. But one important thing you need to know, even the synovial, I'm just drawing a picture and you can understand that. A rapid picture, so that I can make you understand. The very first picture. Just make you understand with a very simple kind of picture. If you can see this picture, in this picture you should excuse me, you should understand that this picture, we can see there are two bones over here. At the same time we can see that there are some cartilages present at the articular end of the bone. This cartilage is called the hyaline cartilage, and it is the articulating cartilage. At the same time, this outside, this is totally a capsule. We can see there is a capsule over here. I can use another pen to show you the thing. This is actually the articulating capsule. You can see articulating capsule. And the green color thing that I want to show you over here, this green color thing is nothing but the synovial membrane. This green color thing is the synovial membrane, and this synovial membrane is producing the synovial fluid inside this cavity, and this is called the synovial cavity. What you need to notice over here is that synovial membrane is not covering the articular cartilages. It is not covering the articular cartilage. Why? Because when there is a friction in between these two articulating surface, there will be the rupture of the membrane, and we do not want to rupture of the synovial membrane. Now we need it as intact structure. So the synovial membrane is present at the site of the synovial joint, not directly on the articulating surfaces. So this is the structure: two bones, synovial cavity lined by the synovial membrane at the inner aspect. At the same time, outer this strong band, they are holding these two bones. This is called the fibrous capsule. So this is actually the picture of synovial joint. For the very first time I am doing this video for you, and there will be some flaws. I am extremely sorry for that, but you need to know that what I am trying to say, that is the joint definition, the classification in a very moderate amount way, because in our actual classes we will discuss it elaborately. At the same time, I have drawn a picture that is called the typical synovial joint. This is very important for your professional exam, not for the written but also the viva. So you have to be very much careful about it. You have to do practice of this figure regularly at your home. So this is all about for today, and thank you very much for your patience hearing, and kindly forgive me if there are some flaws in my videos, because this is the very first time, and without that kind of preparation I have just went for it. So that is all about. Thank you very much for your patience hearing. Thank you. Take care everybody. And one more important message to everybody: nowadays coronavirus infection is pandemic, so please try to maintain your personal hygiene. At the same time, you have to be very much careful about avoiding the crowded places, the public places. At the same time, pray to Almighty Allah for our safety from this kind of massacre. Thank you everyone, and pray for me. Thank you.